Well, welcome back to Week in Review. This is week number 12. I'm Damian David with Healthcare Triangle, formerly Cornerstone Advisors. Last week, our big announcement was the rebranding. So Cornerstone Advisors transforming now into Healthcare Triangle. Got to catch up with Jeff Weber, our Senior Vice President here at Healthcare Triangle. Talk a little bit more, continue down the path, finding out a little bit more about our vision. What's the thought behind becoming Healthcare Triangle, and what does that mean in this time of COVID-19 coronavirus pandemic? It was a great conversation. Can't wait to get there. But before I do, I'm going to review the headlines from this past week that are COVID-19 related. And then after we talk with Jeff, I'll leave you with some music and some visions, just like I do every week. Give you a little bit of hope, a little bit more energy. Keep fighting the good fight for us. Thank you so much for doing what you do. I'm glad that you're staying safe and healthy. Please take care of yourselves. We appreciate what you're doing for your community and for your patients and their families. Keep it up. Keep up the good work. Let's still be cautious and diligent. These cases and the numbers of cases of COVID-19 are exploding in the U.S. Okay, let's get into the headlines here. Monday, June 29th, 2020. Last week, during Week in Review number 11, I promised you a recap of the Meditech Nurses Forum. So here we go. Let's run it down. At one time, it was reported that there were 799 people watching a virtual session. That's much higher than the previous year with in-person forums, okay? Day one, keynote speaker, Rich Blooney prompted us to realize that everything we do is transformational, especially in technology. We need to think of all the lives we impact, even though we may not always be physically with the clients, okay? Day two's keynote speaker was Kelly Fredrickson, and she spoke about how we all need a compass, not a map in these uncertain times, okay? Because what was on the map yesterday will not be on the map tomorrow. Keep that in mind. Day three's keynote speaker was Kelly Corrigan. She read from her book, Tell Me More, Stories About the 12 Hardest Things I'm Learning to Say, which is a moving, meaningful take on the power of right words at the right moment to change everything. Okay, I've left a link in the description for this Week in Review so that you can get to some of the notes that Meditech has on its site in recap of its nursing forum. I also promised you last week that I'd give you a recap of our own Kate Corbett's tweet chat for Healthcare IT Today that was focused on telehealth, okay? Generally, everyone was in agreement that telehealth was quick to stand up because of the pandemic. Things that people took years to decide on and never really got off the ground happened in a matter of days, weeks. Telehealth, it's here. But interconnectivity and workflow, efficiency, thoroughness was rushed. And so now we're kind of going back. You could use a little bit of fine tuning. Some of the flows in telehealth that could still use some help in fine tuning are things like online scheduling, digital forms collection, telehealth training, for example, technology, digital waiting room, clinical documentation and coding, patient payment, and patient education. There's others out there, but let's get those started. Make a better experience. There's opportunity to rework telehealth, make it more humane and humanistic with better emotional connection between the healthcare providers and the patients during the visit. All right, let's get into the news. GILEAD announces that Remdesivir will be priced at $3,120 for patients with private insurance. Okay, that's going to be the typical cost or the typical payment that we can expect for that vaccine for COVID-19. In New York City's facing a $9 billion revenue shortfall. U.S. stocks are down as the world worries about the state of the economy and a resurgence in COVID-19 cases. Mexico's GDP fell 20% this April as compared to the previous April. This is what we're dealing with, folks. It's starting to impact our economy. But at the same time, with spiking cases throughout the U.S., a lot of it because of the opening and the reopening of the different states and the operations. Please, let's continue to be diligent. I ask you, if you're going to go out in public, please wear a mask. Consider it. For all of us. Health experts say that U.S. needs to flatten the curve to prevent any shortages of dexamethasone or remdesivir. Okay, so they're expecting shortages in the medications if we don't flatten the curve. Let's keep working. Right? So I keep mentioning cases are going up. Our economy is worried about it. Everybody seems to be worried about it. Yet American Airlines, as of July 1st, is going to book its planes to capacity in spite of highest cases of COVID-19. So be safe. If you're going to fly in those planes with American Airlines, caring for people on life's journey, please wear a mask. Let's get to the stats this week. World confirmed cases of COVID-19. They're up to, and they've surpassed 10 million cases. So we're at 10.2 million cases throughout the world. We were only at 8.99 million last Monday. We've had 5.17 million people recover from COVID-19 around the world. Compared to last week, we were only at 4.46 million that recovered. Globally speaking, 503,000 deaths from COVID-19. Last week, we were at 469,000. Let's get to the U.S. confirmed cases. We're now at 2.59 million confirmed cases. The U.S. accounts for almost a quarter of the world's cases of COVID-19 cases now. Up from last Monday, we were only at 2.32 million in the country. Of that, 789,000 folks have recovered. Last week, we were only at 722,000 that had recovered. Deaths are up to 128,000 deaths of COVID-19 in the U.S. Last week, we're at 122,000. So there you go. We have the headlines. Well, I'm excited to jump now to a conversation I had earlier today with Jeff Weber, our Senior Vice President here at Healthcare Triangle. I wanted to pick his brain, and I wanted to push him to tell us a little bit more about our vision as an organization and how we saw ourselves in the space and how we saw ourselves helping healthcare. So without any further ado, I bring you to the conversation. Hey, Jeff, great to see you. Thanks for taking the time to speak to me today.
Happy to be here, Damien.
So for those of you who saw last week's Week in Review, we announced the transformation of Cornerstone Advisors into Healthcare Triangle. The triangle component and the visualizations of our logo are important to the essence of the Healthcare Triangle message and the concept and the vision. So I wanted to take some time and speak with you, Jeff. Can you help me break it down? I want to get the vision behind the name. How does it tie to our core ideology?
Sure, that's a great question. And I've got it from a couple of the partners that I've talked to and customers over the last week. So Healthcare Triangle is made up of two companies that are well known in their respective industries, Cornerstone Advisors, an EHR and advisory consulting company rooted in Meditech and Epic, and AK Miles, a born-in-the-cloud company that is focused on the life science space. AK Miles is focused on creating solutions and tool sets that have allowed some of the most prominent life science companies in the industry to accelerate their discovery and research while still controlling costs. And it's those ideas that kind of brought Healthcare Triangle together. And so the two companies, as we came together to focus on healthcare, the triangle represents people, process, and technology. The three components that I believe make every business thrive. I truly believe that digital transformation is here in healthcare, and that's what Healthcare Triangle is built to do, is to help our organizations with innovation, new discovery, find the solutions that they've always wanted to, that technology has been a burden for, and try to clear those burdens out. At its core, we want to revolutionize healthcare through innovation.
So yeah, it's been a crazy, scary, unsettling time over the past 5 months with coronavirus and the COVID-19 pandemic. As it's swept across the world here, it's kind of forced us to do life very differently. Help me reflect on just the past 5 months. What are let's say 3 things that either surprised or impressed you about healthcare's utilization of resources, technology, processes in reacting to pandemic?
Yeah, sure. I think that there's 3 things that come to mind right away. Video or conferencing, telehealth, Zoom, Teams, whatever you're using today, has definitely accelerated everywhere. It was ready. The platforms were pretty mature, and we've had great success with the interactions with people. The social and the health components of that have been met. I think we still have some way to go on how we store the data and how we grab the discrete information that happens during the video conferencing. So there's good things happening, and we're on a journey, and we're going to find those solutions. So I think that's exciting. The second place is all the data that we've consumed and we needed to analyze better. So analytics, moving that from worrying about a department in the hospital to worrying about a region in healthcare, and being able to have data that's not necessarily created in your own organization, interrelated to your data in a data lake in the public cloud. I've heard about lots of different projects that are kicking off, where organizations are taking their data, taking some state data and taking some private data and trying to put greater insights into their patients and their consumers' conditions and how they can help them. And then the last thing, and I've seen this from before COVID, but it has accelerated during COVID, is automation, business automation or workforce automation around repetitive tasks that can be done, via cloud automation. Some of these things may be EHR related, some may not, but automation is here to stay and is only going to grow in all businesses, but healthcare, the widest base to grow in the short term.
Yeah, I'm definitely excited to be part of Healthcare Triangle. I think the timing it's perfect, I think, for our venture into the new vision for the organization. I think we're just ready for things. We're getting pushed off a ledge here, so I'm very excited to see what the next couple of years especially brings us.
Yeah, I think that you're right, that the time has been accelerated to adopt these things like you talked about. The project duration was shortened, but the impact is still as strong. And so we do need to optimize these things and make sure they're working appropriately and getting all the ROI that organizations need. And most of these solutions will also lower cost, which is what our healthcare industry has needed for years. And, is that one of the root goals of Healthcare Triangle, is to reduce the cost of information technology services across the whole healthcare spectrum.
Well, great. Again, I'm excited. Thanks for taking the time. I'm going to put you on the hot seat like I put everybody I talk to. You ready?
Hey, I guess, yeah.
All right. Well, it's an easy one, I think, for you, but hey, let's go for it. COVID-19, coronavirus. What's been your favorite hobby throughout this whole pandemic?
Well, folks that know me know that I have a long tradition of farmers in my family, both grandparents and one parent. So I'm big into gardening, and I have a huge garden in my backyard. And so I have not been traveling. About February 12th, I think was the last trip I took this year. I've had a lot more time to devote to my garden. So I have new plants, new vegetables, new roots and fruits that we're growing here in the central Kansas where I live, which we have a pretty nice summer and temperate climate where we can grow quite a few things. So that's where I spend most of my time.
Well, hey, look forward to seeing some pictures of the yield when it comes.
Sure, yeah.
Thanks a lot, Jeff. Really appreciate it. Really enjoyed talking with you. Glad to see you're doing well. You're safe and you're healthy. Take care.
Thanks, Damien. Have a great day, and thanks for the time here today.
Special thanks again to Jeff for taking the time to talk with me earlier today. And again, another special thank you to you. I know that we're working hard. It's been months and months and months of being in a pandemic with no guarantees, not a lot of answers for the questions that we've had yet. We're still in the unknown, but hey, we keep trudging along. And that's because of the effort and the energy from you. So again, thank you very much for the sacrifices you made, for putting yourself in harm's way to improve the lives of your community and their families. Take care for the rest of the week. Continue to be safe. I'll see you next week. Here's a great tune for you.
So you think you can tell heaven from hell, blue skies from pain, telephone field from a cold steel rail, a smile from a veil. Do you think you can tell? Didn't they get you to trade the heroes from ghosts, hot ashes for trees, hot air from a cool breeze? The gold comfort will change. Did you exchange a walk on powder wood or a lead roll and change? How I wish you were here. We're just too long.